Hello, I'm Dr. Brant Gibson, and today I want to talk to you about neuroprotective vitamins. Um, the idea is most of the time, if you have peripheral neuropathy, we want to start with neuroprotective vitamins. Even before you know if you have a deficiency, before you know if you have a dependency, we want to help you actually find a solution by treating with neuroprotective vitamins. So the point is there are certain vitamins that are very, very valuable and can help with the protection of the nerves. They are valuable in that they provide nutrient support, and they can even help in the repair of mitochondria in the process of protecting your nerves from further damage. The studies have shown this to be very valuable. There are possibilities of toxicities with any particular vitamins, and so you want to be careful and you want to make sure that you're being managed by a physician as you do this, but neuroprotective vitamins are a good idea. So let me go through the most common neuroprotective vitamins. Number one is vitamin E. This is the one that has been studied several times and actually been shown to be valuable for chemotherapy or other cancer type treatments as a neuroprotective vitamin. It is a powerful antioxidant, and it can reduce the free radical damage to the nerves, blood vessels, and other surrounding tissues. So it is valuable for many forms of toxic neuropathy, especially chemotherapy and cancer treatments. A recommended dose is 300 milligrams per day. Because it is fat soluble vitamin, we recommend this is only in a single dose. So a lot of people will do this first thing in the morning. The other ways that you can get vitamin E, which are valuable sources as well, are through food sources, including vegetable oils, nuts, especially almonds, hazelnuts, pine nuts, peanuts, and Brazil nuts. You can do it in certain seeds, especially sunflower seeds, turnip greens, peanut butter, spinach, and avocado, uh, tomato products, fortified foods. A lot of times vitamin E is added into these fortified foods, such as margarine, spreads, fruit juices, and cereals. I don't recommend that you go the margarines or some of these other spreads, as there are other negative effects on the nerves. But again, that is one way where you can get vitamin E. Number two, this is probably the most valuable neuroprotective vitamin there is, because so many individuals are found to have a thiamine deficiency anyway, but this is vitamin B1, benfotiamine. Now you'll notice that even though we're treating a thiamine deficiency, we're given it to you in a benfotiamine form instead of thiamine, because thiamine is a poorly bioavailable. It's very hard to absorb. It doesn't get absorbed right. And so if you take just a thiamine in a vitamin, which a lot of times many of the multivitamins, that's the form it's in, your body's not going to really get any nutritional value from that. So benfotiamine is what we're looking at. It has been studied over and over and over again, and it's been shown to be very valuable as a neuroprotective vitamin, very valuable in preventing cell damage at the mitochondrial level. So it keeps mitochondria from being damaged. It's been found to be valuable in the repair of mitochondria, and therefore it is a supplement that I will use almost universally with peripheral neuropathy patients. Dosage wise, it's giving at 150 milligrams to 300 milligrams per day as a water soluble vitamin. Therefore, it's usually given twice a day, usually morning and night, 150 milligrams each time to give you the benefit there. This can also be found in foods, and the food sources are absorbed. I mean, such things as the cereal grains, oatmeal, flax, and sunflower seeds, brown rice, whole grain rye, asparagus, spinach, green peas, kale, cauliflower, potatoes, oranges, liver, soy milk, and eggs. I mean, all of these will give you the thiamine sources that the body will absorb. But a lot of times we do supplement this one. The third one is alpha lipoic acid. This should be in the form of ALA, because alpha lipoic acid is such a valuable supplement for peripheral neuropathy, such a valuable antioxidant, such a valuable treatment to prevent toxic damage to the nerves, and to prevent diabetic vessel damage. This is a good one to add, especially in diabetic patients. for protection of the nerves. Recommended dosage is 600 to 1200 milligrams per day. This is also water soluble and is usually done in 2 or 3 times per day. So sometimes we'll actually use this one every meal. Food sources, alpha lipoic acid is in a lot of foods. Most prevalent, of course, in kidney, heart, liver, spinach, broccoli, and yeast extracts. So if you'll notice that spinach is a good option in all 3 of these as a neuroprotective nutrient. So it is something to consider adding to your food as part of your neuroprotective vitamin process. The 4th and final neuroprotective vitamin that we usually will start people on right off the bat is vitamin C, also known as L-ascorbic acid. It is a powerful antioxidant, is required in the production of tissue such as collagen, neurotransmitters, which is the signals that are sent from nerve to nerve to help them communicate. And it is very valuable in helping in the repair of all aspects of the nerve, but even more importantly, in protecting from the damage that is happening on a regular basis to all the tissues, including the nerves. So this is a valuable neuroprotective vitamin. It's one that we haven't been using for as long, but because of all the beneficial effects of vitamin C, it is something that we will start early on. Recommended dose is 1,000 to 2,000 per day, and usually should be done 2 to 3 times a day as well. Food sources, of course, are pretty easy. You start looking at it, you're saying, okay, it's going to be in most fruits and vegetables, especially citrus fruits, tomatoes, tomato juice, potatoes, red and green peppers, kiwi fruit, broccoli, strawberries, Brussels sprouts, cabbage, cauliflower, spinach, and cantaloupe. So a wide range of nutrients, a wide range of things that can be done. I recommend that you add these as the initial step in treating and managing your peripheral neuropathy. This is Dr. Brent Gibson. This is your neuropathy nugget day 236. And the whole idea here is to help you start with the neuroprotective vitamins, because these are so valuable and these are so helpful, and these can cause significant improvement of symptoms and a significant improvement of even some of the discomfort that's happening from peripheral neuropathy. But the most important reason is it keeps the nerve damage from progressing. So, Dr. Brent Gibson,